Worth.
Thank you, Madam Chair. Maybe not so much a question, but just, I'd like to thank you and the ranking members so much for keeping the spotlight on this issue. I know we've had several hearings about this. We've had governors in talking about state health insurance and individuals and small business, so thank you very much. Obviously, this is something that we look forward to getting something done about, and I know you're committed to that, and I look forward to next year too, like Dr. Nichols said, regardless of who's in the White House, that this is going to be a pressing issue for the new administration as well as us. Sitting over here listening to the panel, and I had a flashback to when I was interviewing in my former life, interviewing potential employees, and being a former law enforcement officer, you'd always ask the question, why do you want to become a deputy sheriff? And you'd think it would be to protect and serve and things like that. And I actually had, as time went on, I had people saying, well, I hear the county has really good health insurance benefits as their reason for wanting to become a deputy sheriff. Now, I didn't hire those people, but they were pretty honest. But I thought that was a telling thing that they were willing to come in and want that job just to get the health insurance benefits. I hope they're listening today, and if they're reapplying to that, they'll think of a better answer than that. But it's, as Mr. Shabbat said, I spent yesterday on the phone anticipating this hearing, talking to small business owners in my district with my roundtable, and just the stories that came from them, minus one gentleman who owns a trucking company, and fuel prices is his number one, but health insurance and health care for him and his employees were all of their number one issue. And just listening to some of the stories that they had were, gaming that deductible system. I know one of the gentlemen talked about that he selected a plan with a $2,500 deductible and then asked the employees to pay the first $750. He would take the gamble on paying above the $750. Anything that they didn't spend. He was just gambling. Other issues that they talked about were that the insurance companies, they're demanding that 50 or 60% of the employees get on the program, and that's not always possible in a 5-person job. If the spouse of somebody works and it's a better insurance plan, they're not on there, so they're hampered by that. So there's just again, I don't have a lot of questions because I think we all know where this has to go. It's letting the rubber meet the road and getting these things done. And I look forward to you and the rest of us just keep pushing until this actually happens. So with that, I'll yield back, but thank you all very much for your input.
Thank you. Mr. Fortenberry.
Thank you, Madam Chair, and thank you all for joining us today. Dr. Bloomberg, if I could summarize your testimony, because unfortunately it was the only one I was able to read through since being here fully. I think your suggestions can be summarized as follows: better pooling for small firms, high-risk pools, which is a government subsidy for persons who have chronic health conditions, and some form of premium assistance for individuals of lower income. Is that correct?
Not necessarily. The issue of the high cost is a really critical one from my perspective, but whether you are going to address that problem by taking the people and separating them out into high-risk pools versus changing the way insurance is priced and risk is pooled in private insurance in general is a very big decision. So I think we need to be very cautious about how we go about that in order to make sure that coverage remains adequate and affordable for people regardless of their health status. For example, if you take the route of going with high-risk pools for those that are high cost, they're separated out from the people that are lower cost. And so if you're going to subsidize their coverage explicitly in order to make it affordable, the cost to the government is going to be considerably higher than if their costs are averaged throughout the population. The costs are the same. You have to pay for all of the costs eventually, one way or the other. But it's a matter of how much is going to come directly from government revenue versus how much is going to be spread through premiums. And so those are big policy decisions, and I wouldn't say that high-risk pools are necessarily the right way to go.
Well, then that would beg the question as to whether a form of premium assistance for a person who falls out of normal risk categories that perhaps couldn't be absorbed into smaller pools like you have without really breaking the back of the ability of the employer, if we're going to agree that employer-based insurance is, for a number of the reasons that you all cited, is the most efficient way and perhaps the most societally beneficial way to continue to have proper access to health insurance coverage.
I think that buying coverage through employers, particularly large employers, is more efficient at this point than buying person by person because of administrative costs. But I think a lot of us have been talking about the notion of creating structures or building on existing structures that would allow coverage to be purchased outside of the employment context as efficiently as many employers do.
What would that look like?
What that would look like is a purchasing entity, maybe something structured similarly to the federal employees' health benefits plans, which is what Stuart was speaking about, based on state purchasing pools or state employee plans. You could do it through public programs. You could open up Medicaid and S-CHIP for purchasing coverage for individuals of varying income levels. Those are, most people in those plans are already enrolled in private health insurance plans. They're just being contracted by the state. You could set up a connector-like entity, as they've done in Massachusetts, which is the state creates an entity where they're deciding what the array of health benefits are going to look like, and they contract with the insurers in order to provide that for either individuals or small businesses that want to buy into it. So, but the key is that we have to be really careful about how we slice up the covered individuals in insurance coverage. The more choices that they have, the more options that they have available to them, the more we segment risk. And so we have to be very careful about how many choices people face and how they're priced in order to make sure that we spread the cost as broadly as possible.
Let's talk about two aspects of that, and others of you can chime in. One is the Health Savings Account initiative that tries to drive the consumer back into the equation when rationing limited dollars in ordinary cost, but when there's an extraordinary or catastrophic condition, there's clear coverage. Mr. Ellsworth is right. It's an amusing story, but I think it's very, very true, and this also is a question of portability, that the dampening effect on economic productivity by having a person seek employment merely for the benefit of health insurance versus using their skill sets, trying to find the right place to exercise their gifts and increase productivity overall in society is a very real drain on productivity. And so we talk about an employer-based system, and you all are generous people, those of you who have been in business, and I think most small business people are trying to help their employees, but because you get a tax benefit, in effect, for doing this, plus the fact that it's about retaining employees, we used to call it in the corporate world the golden handcuffs. These benefits get big enough, you're going to think twice before leaving, or you're going to seek a position for the benefit alone versus the opportunity to, again, find the right fit for your own skill set. This happens a lot in rural communities where a spouse will leave a farm or another entity simply to go to some level of governmental entity for the health insurance benefit. So the issue of, while I agree with many of the points you're making in regards to the efficiency of delivering health care through the business platform, I think we have to think also about this issue of portability and this drain on productivity when a person ends up being basically chained to the desk that they're at because of their need for health insurance. So.